Hello, thank you for joining us on the program Delta Health Insurance Scheme and You. I am Eunice Amiazo, your host. Let's begin this episode with a news report of an activity of the Commission where the Director General and Chief Executive Officer of the Commission, Dr. Akpoveta, sensitized civil servants on the rights as far as the health insurance scheme is concerned, so that with this knowledge they would be able to demand for their rights when they go for treatment. We'll take a short break after that, and when we return, we'll serve you our main dish. A little insight on this though. This particular dish, you know that the Delta State Contributory Health Commission has been focusing its attention for a while now on effective healthcare delivery. And after training healthcare under the scheme for a time being, he has moved to training primary healthcare workers across the 3 senatorial zones. So in this report, we'll be bringing you all of that, beginning from the training we had in Delta North. Stay tuned. We'll be right back.
Delta State Contributory Health Commission. Of we kaye Lord the Brubotore Delta. Ereso de bioto rawole ye bioyibo se health card. Emo egbuku yan ipoto. IT so de na bioto rawole ye bioyibo se health card na. Lai se wo pe asare di sin wo ma. Obi be bioyibo se health card na. O mesi mo be oiro. Obi be bioyibo se health card na. Eru bo te wo de mrefu. Ofe oiro. Obi be bioyibo se health card na. Wo de kevie. Ofe oiro. Delta State Contributory Health Commission.
In its avowed commitment to ensuring accountability and transparency in the implementation of the State Health Insurance Scheme, the Delta State Contributory Health Commission has engaged with civil servants in the state. The event, which held at the Association of Senior Civil Servants Hall, Asaba, saw representatives of various ministries, departments, and agencies in attendance. Addressing the gathering, the Director General and Chief Executive Officer of the Commission, Dr. Akpoveta, said the forum was to ensure enrollees of the State Health Insurance Scheme, especially those in the formal plan, had proper knowledge of the Commission's recent reforms and their rights under the scheme. Dr. Akpoveta said the Commission had engaged doctors, nurses, billing officers, accountants, pharmacists, and officers in charge of primary healthcare centers. He urged the workers to keep receipts of any unlawful payment and report the said health facilities to the Commission for proper disciplinary action, and gave an assurance that the Commission would refund the money spent.
It's ongoing sensitization of the system, real sensitization. We'll be going around the state, we talk to the doctor, we talk to the nurses, we talk to the counter. Everybody in the health sector need to be brought on board in the new view of the more agenda and outside the health insurance scheme. And one of the greatest, most serious stakeholders of this scheme is labor. You know that labor is represented in the board, and everybody must know what is going on. As much as their representative is informing them, it is good that I open up the new policy, the new direction, and what needs to be done to ensure that the scheme is well implemented and well received by the civil servants. So today's policy is to talk to the civil servants about how the scheme has been directed, what we are doing to protect their interests, to ensure they receive the best of care from the provider. And you can see the innovation. They were very, very glad that we came here. So it's an information, capacity building, knowledge-based building, so that they can know what is their rights and demand for their rights. Before, they were not being given attention enough. We are putting into the system several monitors that monitor that the hospitals attend to the civil servants and rid of the scheme promptly and carefully. Secondly, we make sure that we have a monitor at the pharmacy to ensure that prescriptions dished out to them by the doctor is well filled and is not they are not compromised. We have ensured that the attention is given to them as best as possible. So there's a lot of, and then make them to be aware what is covered, what is not covered. So nobody can deceive them, oh, yeah, it's not covered, go and pay money. No. We also let them know that if they are forced to pay money, if you keep the receipt, bring it to us.
The chairman of the Trade Union Congress TUC and Association of Senior Civil Servants, Comrade Bolo Mwachukwu, commended the Commission's prompt response to feedback. Comrade Bolum, who is also the Director of Administration and Human Resources at the Delta State Contributory Health Commission, explained that due to the large number of civil servants, 5 representatives from each ministry unit executives were invited to participate at the forum.
We looked at the complaints coming from the people and we tried to provide solution. For the past few months, we've been interacting with the hospitals and other stakeholders. So at this point, we felt it was necessary to also interact with the enrollees themselves, those who go to the hospital. Because most of the complaints we receive come from the workers, the civil servants. And to talk to them, we felt that the best way to reach out to them, we cannot bring over 5,000 civil servants into one. So we decided to take their representative, 5 from each ministry, to come together. That's the unit executive of the association, to come together so that we can share ideas, brief them on the innovations and the way forward, the way we try to answer the challenges that are there, and also get more empowerment. And I think it's a beautiful one because many things they never knew. They come to me. We need to inform the people. We need to tell the people what is going on. Because the complaints from the hospitals most of the time borders on the ignorance of the people. But for example, they tell them there is no drug when they don't have any rights to say that. They tell them that 500 naira or 480 was paid, you cannot cover them because they don't understand the question of competition. So all these things is to bring to the fore what the true position is, so that the people will also know what the commission has put in place to checkmate these things to make sure that the scheme is beneficial to them.
The Delta State Contributory Health Commission, they don't come again to remind all pregnant women when they for inside Delta State to say may they go register with the Delta State Contributory Health Commission scheme and get their health card. Even all pikin when they for 0 to 5 years must also register and get their health card before they go get any kind of treatment for our hospital. Because from now on, it go be say no health card, no free treatment, no health card, no free antenatal, no health card, no free delivery. Now the Delta State Contributory Health Commission now they bring on this ogbonge tori o.
The Delta State Contributory Health Commission has trained primary healthcare workers across the Delta North Senatorial districts on how best to adapt to the Commission's new policy framework. The training, which held at the Commission's headquarters in Asaba, is coming on the heels of recent technological advancements developed by the Commission to ensure speedy and more efficient service delivery to the enrollees of the State Health Insurance Scheme. Speaking with journalists after the training, the Director General and Chief Executive Officer of the Commission, Dr. Isaac Akpoveta, said beyond increasing the number of enrollees into the State Health Insurance Scheme, the Commission was putting sustainable measures in place to improve the quality of care and enrollee satisfaction at the primary healthcare level. Dr. Akpoveta said the comprehensive training program on the new policy framework introduced earlier this year is part of a broader strategy to empower frontline healthcare staff, reinforce accountability and ethical standards.
At the moment, we are driving, in the beginning we've been driving enrollment, and we've gotten to 2.6 plus million. But now we are concerned with the services being received by these enrollees at the hospital side. And so the policy this time around is more of the quality of care that the enrollees are receiving at the facilities. Initially, we drafted our service quality monitors to most of these hospitals. First of all, to register, to encounter patients that come for treatment. They must be properly encountered and confirm that they are genuine, they are valid people. Because we got in the past a lot of uncertain number of people that we didn't think were really properly released. So our service quality monitors monitor treatment, monitor prescriptions, monitor dispensing, monitor the quality of care that the people are receiving. And the process also encounter them, take their photographs, record that they were really the people that came to the hospital with care. But we are moving a new step. We realize that we can't have a agent that will cover all the hospitals. There are about 600 primary health care, private hospitals, government hospitals, access to finance hospitals. There are quite many, over 500. And we need an average of so many monitors. And so we can't cope alone. We now invite the hospitals, primary health care centers, to ensure that their record officers are trained to carry out their function. Registration of a patient in a hospital is a duty of the record department of any hospital. But we took over that function to make it seamless. At the same time, we will hand-on training of their staff. And so this meeting you saw today is the training of the primary healthcare centers in Delta North. Not only the OIC, the matron that is in charge, but at least 2 more persons. The record officer, the dispenser, or a nurse, the SHU that is working with them. The purpose is first of all to train them on the new policy and how to implement it. And secondly, to train them on how to encounter patients by themselves. And 3, to train them on how to send their bills, prepare the claims, and send it to us electronically, nothing manual anymore. And so the training is multifaceted to ensure that they are well groomed in registering their patient, encountering the patient for care, ensure that they know how to prepare the bills of the patient, and also to advise them on how to care for the patient. Especially ensure that they receive their complete prescription.
He noted that the healthcare workers were the first contact enrollees had with the system, hence their professionalism, empathy, and integrity remained key. The DG called on the healthcare workers to desist from extorting enrollees and ensure they applied for drugs from the Drug Revolving Fund (DRF) 2 weeks before their drugs are expended to bridge any gap at the point of care. Dr. Akpoveta commended Governor Sheriff Oborowori for his consistent support and commitment in the health sector, which he said had been a major source of motivation to the Commission, reiterating the Commission's commitment to building a robust workforce to drive the policy, particularly at the grassroots.
So the PHCs are very vital to this scheme. Without PHC, you cannot achieve universal health coverage. Universal health coverage have many components, but 2 key components is financial equity, and then also equity, financial assets, and physical assets. You can have your money, but there's no hospital to go to. It's too far away. You can have access, there's a hospital by your doorstep, but you cannot access it because you don't have money. So these 2 components are very important, access. And so, luckily for Delta, almost every village has a primary health care center. So we have close to 500 primary health care centers across the state, plus the government hospital and other hospitals. So we have a good spread. But the primary health care centers need to be properly managed. They need personnel, they need resources like drugs, they need equipment. Like I said today, we'll probably find a way to see how we can help them achieve a side lab where they can be doing urine tests or all those minor tests before sending the person to the next bigger hospital. So we want to ensure that the primary health care centers are properly organized. And one of their challenges is drugs. The drug supply system in Delta State is centralized from DRF And DRF have to supply drugs to every nook and corner of the state. It's not easy. Even if they have the money, the distribution is a challenge. And so some of the hospitals are not getting drugs on time. And two, they don't make requisition for the drug on time too. So we held a meeting at the top level with DRF manager and other stakeholders, and we agreed that all the primary healthcare centers and hospitals should apply for drug 2 weeks ahead. Look at your stock. As your drug stock is depreciating, you should apply for drug because there's a time lag between request for your drugs and then the delivery of the drugs to you.
Participants who spoke at the end of the training, including heads of primary healthcare centers, billing officers, and pharmacists, commended the DG, Dr. Akpoveta, for making the training interactive and gave an assurance that the knowledge gained will be put into good use.
Interactive, and it was clear. I told someone, this man was very good lecturer. He lectured well. He didn't need any lecture. And so after this training, I'll be able to effectively do my work without any problems.
The party will tell me that at least develop another method, or just a new method of doing your work perfectly without any error. Because the other one was kind of use another system again, in order to put in your best, give out the best.
For today, we have learned a lot of things, even innovations and policy under the contributory health. And the DG has made it so easy that was able to bring out a test of a person and able to show us what they are doing and what they have faced so far. Especially for those of us who are new into the system. At least what they paid was what I got, and that was what was shown to me. I want to say big thank you to Delta State, to the governor for the services so far to privileged, and also to the commission for their good work to see that the PHC are also functioning. It has done so much with PHC in terms of healthcare, making our mothers and the less privileged to come to utilize the health facilities, and even to the workers. The commission has made us to help us to get some workers because of lack of manpower in the system.
We are trained on how to do our capitation, how to raise claims, and how to enroll our patients using the e-health application and the self-cognition app. Before now, I have no idea of using those apps to enroll our patients. But after today, I think I can enroll our patients perfectly. It's a nice one actually. It's a very good one because the health industry is an industry where you learn and you learn new way of doing things. So from today's training, we learn a lot.
The training continues in other senatorial districts of the state. In continuation of its efforts to ensure enrollees of the state health insurance scheme derive maximum satisfaction from services rendered at the primary healthcare centers, the Delta State Contributory Health Commission has trained primary healthcare workers across the Delta Central Senatorial District. The training, which saw the participation of over 300 primary healthcare staff, held in Ughelli. The Director General and Chief Executive Officer of the Commission, Dr. Akpoveta, said Governor Sheriff Oborowori had made huge investments into the health of Deltans, and it was proper for the Commission to ensure the efforts of the government was not in vain. Hence, the decision to train the primary healthcare workers to be abreast with the new policy guidelines of the Commission. Dr. Akpoveta expressed satisfaction at the turnout of participants at the training and their level of attentiveness and urged them to use the knowledge to improve on their services rendered to enrollees in their various facilities.
The training is across the state. It is meant to upgrade their level of understanding of the current policy in the state. You are aware that we changed some of the key policies, dynamics, to ensure effective and efficient service provision in the state. Remember that the primary health care is provided in distributed facility in the state, covering almost every community. And therefore, if they can grab the basic knowledge and implement it thoroughly, substantial achievement will have been made. So today I talked to them about payment system, clearly capitated on the bond. What is capitated on, why is it important, why we are paying up front, and what they must do. And they understood that. You know, I even put a small price tag on it, and they were very happy to drive it in. And I'm sure performance will increase from now on. So the basic things that we are training the primary health care head of primary health care system, the patrons, and other persons, the head of what called OIC, officer in charge, and their co-workers, their field officers, dispensers, so that they can understand the whole dynamics of everything. I started by defining what is ignorance in a local language. At the end of the day, we were black. We also informed them about what the government is doing. The government have done so much on behalf of the wife and pregnant. And why the government was particularly interested in the pregnant people. And we quite understood what is going on. And we are quite happy with the government. And people were singing and praising the government for its efforts.
Participants expressed gratitude to the Commission for the new innovations introduced to make their work easier and for taking further steps to train them, saying that areas where they had acted in error had become clearer to them, even as they pledged to put the knowledge gained into good use.
My facility is Akpoveta in Ukeli South Local Government. I am a nurse. The new thing I saw today for the director to start, Director General, to come down from his stool to come and train participants by himself. That's a very new thing for me. And apart from that, the way he consulted with everybody that were in the training today is a new dimension. The challenges I have, because there are some of the people that we pay, actually they will not come. And there are some that we pay, and they will not pay, but they will come. They were able to sort them out, and were able to also understand that we still need to talk to people so that they will go into the scheme, so that they can have that free medical care that Delta State is offering.
The training featured presentation of gifts to deserving participants by Dr. Isaac Akpoveta. Having successfully trained primary healthcare workers in the Delta North and Central Senatorial districts of the state, those in Delta South for their turn. Eunice Emeazia reporting. As enrollee satisfaction in the implementation of the state health insurance scheme continues to top the agenda, the Delta State Contributory Health Commission has trained primary healthcare workers across the Delta South Senatorial District. The training, which drew primary healthcare workers from different communities across the Delta South Senatorial District, held in Warri. The Director General and Chief Executive Officer of the Commission, Dr. Isaac Akpoveta, said the training had been intensive and practical to ensure the participants were equipped with the requisite knowledge to implement the new policy guidelines of the Commission. Dr. Akpoveta said Delta State had maintained its #1 position in the country in terms of healthcare, but the Commission was not resting on its oars, adding that all efforts were being channeled to close all gaps capable of disrupting the vision behind the state health insurance scheme. He said Governor Sheriff Oberewori, in line with his more agenda policy thrust, had empowered the Commission to carry out its mandate, which is aimed at providing affordable and quality healthcare, as well as reducing out-of-pocket medical expenses of residents of the state. The DG expressed optimism that with the training, participants now had the knowledge and skills to provide improved services to enrollees in their various facilities.
I told them that primary health care is the bedrock of universal health coverage. Without the spread of primary health care across the nook and corners of Delta State, we cannot achieve universal health coverage. So they are quite important. They made that clear to all the OICs, and therefore they are glad to adopt it. And I'm sure they will continue to adopt and accept the principle of editorial, because they're going to also make money from the primary health care centers. They will treat lives and they will ensure the safety of people in terms of health. And so they are glad. I will continue to encourage them and encourage Deltans to register into the scheme in the primary health care centers. There are a lot of shortcomings in primary health care centers in terms of resources, human resource, medical equipment, and so forth. Security issues. I'm going to take this up with the system and see how we can ameliorate this level of discomfort on the performance of the primary health care system as a result of shortage of resources that we need. We have to make the principle. You can see I'm adjusting the policies to fit into the old way of doing it. We cannot do it. It's not a state jacket thing. We need to adopt and adapt to the situation we have. And I'm sure between now and the next 6 months, a lot of changes will have occurred in the healthcare system.
Participants thanked the Director General for educating them on the concept of health insurance and their role in helping citizens benefit from government programs, promising to put the knowledge gained into good use.
On behalf of the all IGAs in the Delta South Senatorial District, the communities, the wards, and all the OICs and workers, we want to appreciate first the Almighty God that has given us the ability to be here today. And secondly, and most importantly too, we want to appreciate His Excellency, our Governor, Elder Sheriff Oberewori, for this laudable project of the State Contributory Health Commission that is reaching out to the less privileged in the society. It has brought a lot of smiles and hope to the less privileged. And to our amiable Honorable Commissioner for Health, Dr. Joseph Ono-Jaime, who is the father of health in Delta State, for supporting the more agenda of our executive governor. And to our father in the commission, the royal physician, Honorable Dr. Akpoveta, for standing strong and bringing life to the Delta State Contributory Health Commission. We want to say a big thank you, sir, because on his lies the head that wears the crown. Paying those people who are doing excellently well according to their performance. You have been appreciating hard work, and we promise as OICs in charge of the various health facilities to do our best to key into the more agenda of the governor and the commission's policy to see that our mothers who are pregnant are given quality maternity care, and our children under 5 are treated. By this, eradicate maternal and child death from Delta State.
Primary healthcare workers in the Delta North and Central Senatorial districts of the state had earlier been trained by the Commission. Eunice Emeazia reporting.
Well, so there's so much information packed in this episode, I guess. You had a lot to take home. Join us again next week for a fresh package. I am Eunice Emeazia. Bye for now.